Interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show, September 7th here. Wow, we're flying through September already. Great program tonight. We're going to talk a lot about the ear, nose, and throat. I have a head and neck surgeon and otolaryngologist, Dr. Hina Gupta. Welcome to the program.
Thank you. Thanks for having me.
And pronounce that for me because I think I butchered it.
You did a little bit. Otolaryngology. Oto means like ear.
Okay. Otolaryngology.
That's
there,
right.
I got it.
Good job.
Well, we had a hepatopancreatic biliary surgeon on the program Tuesday, so we had to follow up with you.
You're ahead of the game.
We had to do it. I wanted to have you on the program. I've only had one ENT on in the last 3 years of doing this. We've had hundreds of doctors on this program, and you're a little different because you're a head and neck surgeon as well, not just ear, nose, and throat. So that's important. That's a little more advanced specialty.
Well, otolaryngology includes head and neck surgery.
Oh, okay.
And it's commonly known as ear, nose, and throat because that's what the layman knows, that we treat all disorders of ear, nose, throat. That includes, pretty much anything, include the oral cavity, the larynx, all ears, all of that.
Wait, so is that one of the reasons that patients normally look you up, or are they normally referred by maybe a primary care or family doctor?
Absolutely, and the reason is because we have an entire residency and training that includes teaching medical management and then also including surgery when medical management fails. So that's why we're both medical doctors and surgeons.
Oh, that's great to know. And I kind of, I've had a couple sinus issues in my life, but luckily they've gone away. And one of the times I actually was listening to the radio program, it was actually a different radio program, but I do listen to a lot. And I had heard an ad for a balloon sinuplasty, and it was great marketing the way they described it, and this radio host. But luckily my sinus issue came away. Is that something that you do as well, and ENT would do?
Absolutely. So balloon sinuplasty is, it's been around for less than 10 years, but sinus surgery obviously has been around forever. Mm-hmm. And classically, when you would go to do a sinus surgery, you came out of surgery, you had a lot of packing in your nose, you were put to sleep. People described it as kind of a roto-rooter. But now you can come in and we can do it with minimally invasive procedures where you can do it right in the office. And you go home right after the office. It takes a couple hours out of your day. And you can, go about your business very quickly, not like it was in the past. And
get back to the quality of life.
Right.
And get back to work maybe the next day.
Absolutely.
Okay. How does that work, though? So you actually inflate a balloon in the sinus cavity?
Absolutely. So a lot of times you have sinus disease because the outflow pathways for where the sinuses drain are constricted, and that's what causes recurrent infections or chronic infections. And so just like you have a balloon that can dilate the vessels in the heart, you can have a balloon that you track into where the sinuses are narrow, and it opens that pathway. Very
important. Thanks for explaining that. We're here with Dr. Hina Gupta, and she's an otolaryngologist. I'm gonna keep doing that.
I'm getting
better. ENT, ear, nose, and throat, and a head and neck surgeon. Tell us a little bit about. So we're sitting here in Delray Beach at our studio today, and but we broadcast into Broward County as well. So tell us a little bit about where your office is located and about your office, because there's other specialties right in your office.
Absolutely. So I wanted to come here because we opened up this brand new office, and it's been a month, and we're really excited. We've been working on it for 3 years now, so it's been up and coming for a long time. And where it's called Broward Specialty Center. Mm-hmm. It's located in Coconut Creek, and we have a urologist, a gastroenterologist, a pain management doctor, and so we have high hopes to make this a center for surgical subspecialists.
And right there in the office, most of it can be done, right?
Most everything, yeah.
Okay. And the urologist, I saw on the website, it's a urologic surgeon as well, urological surgeon, is that the way you say it?
Yeah, it's surgery, urology. So there's, 5 surgical subspecialties. Ear, nose, and throat, urology, ophthalmology, and orthopedics. We have somebody in the family, but not in that particular location. But yeah, that includes all different subspecialties.
I'm always fascinated. We've had a lot of GIs on here, gastroenterologists, and really fascinating subject. Not until I interviewed a doctor would I think that was fascinating, but I really do find it fascinating. There's so much that goes on in that cavity there.
Right.
So it's neat to hear the explanations as well. And tell the listeners a little bit about your experience. So you've this center has been open a month, but you have experience in South Florida prior to that.
Right. I've been here for 6 years now. Before that, I trained at University of Iowa. I'm from the Midwest originally. That's where I met my husband during training. And he's the urologist, by the way, just so you know. So, so yeah, we've been in Coral Springs area now for 6 years, and I've been practicing for that amount of time here. And this is just a new chapter in our life.
What brought you to South Florida?
My husband and and his parents, basically his whole extended family is in South Florida.
Very nice. Well, we're glad to have you here because, having a great ENT, that's very important.
Right.
Because there's obviously a lot of issues with the ear, nose, and throat as well. But at your center, gastroenterologist, your husband's a urology surgeon as well, urologist.
Right.
And
Pain management.
Pain management, that's right. And Coconut Creek over there. And we'll give out the info as well. Now, you also, as an ENT, can help out. I've learned a lot about this in the last few years. Actually, my mom had an issue with her thyroid. I can tell you, like 4 or 5 years ago, before I was in the medical field, I had no idea the thyroid even existed. Now there's thyroid and parathyroid ailments.
Right.
Now, someone can come to an ENT like yourself for that kind of treatment?
Yeah, so, since I'm a surgeon, we operate on any masses that can occur in the thyroid and the parathyroid. There's a lot of tumors that can happen within those areas, and so I can operate on those. But I liked ENT because I see that's so varied. In one day, in one afternoon, I can see a 1-year-old and I can see a 90-year-old. And so I just like the fact that there's so much variety and we can treat so many different types of diseases, including voice disorders, hearing disorders, allergy. It's just really all-encompassing, I feel.
I actually have a 15-month-old, so I know about the tubes in the ears, which I was reading on your website. And that fascinated me that you treat, from pretty much like newborns all the way to your oldest patient could, like you said, be in their 90s as well. So that's very important.
I've had 300-year-old patients in the last couple of years, yeah.
Okay, that's great. People are living longer, and it's one of the reasons we do the show is to bring the latest and greatest in health across South Florida. I always, when doctors thank me at the beginning of the show, I always say, well, thank you for, coming on this adventure of health, because we're like you said, we're the layman, we're the general public. It's great. I know people are very educated nowadays on their health care. They'll do the search. Everyone Google searches right away.
Everybody uses Dr.
But then, I've even for my own ailments or issues started reading medical journals, and I find them interesting as well. But it's what I'm trying to get to is you have to have a great resource. And your family and friends have to, know what's out there. That's so important in your health.
Well, there's so much advertising that happmes, right? Like directly to the patient. And so it's hard to sift through what's good, what's not good, what's a moneymaker versus what's really good for your health. So I completely agree. And I have that when I have something not in my field, I'm not just using the online search, I'm calling a lot of people because experience does matter, right?
Yeah, definitely. That's a good way of putting it. And I just want to go back to thyroid and parathyroid. So most cancers with the thyroid can be treated early and have a great success rate if they're found early and the patient stays on the regimen. Is that correct?
Absolutely. So thyroid carcinoma is classically a very slow growing tumor in cancer. If there's also benign tumors in the thyroid as well. And so, yeah, I mean, it's kind of like prostate cancer. It's very slow growing. It's not like a malignant killer, but if treated in an ideal, timely manner, you can cure it. Nice.
And we're here with Dr. Hina Gupta, ENT, ear, nose, and throat, head and neck surgeon. Tell us again, you're in Coconut Creek. Whereabout are you located in Coconut Creek? Is there certain intersections?
Oh, it's right by the promenade.
Okay, right by the promenade.
By the promenade. And we have a second office in Pompano. Well, that was our first office. This is our new office. And then the urologist who's part of Broward Specialty Group also has a place in Delray as well.
So, okay. All in the same network.
All in the same network.
Good to know. Good to know. Now, I had a couple questions also about the ear, and one of them I was looking up was chronic and acute ear disease. Is that a common ailment?
Yeah. So you can have patients like you were mentioning, kids who have one ear infection or multiple ear infections. So you can have anywhere from infections to hearing disorders to balance disorders. All of that is encompassed in ear disorders.
Okay. And is that something that you see a lot more in adolescents, children, or adults, or is it kind of a little bit of everything?
You see the ear infections more in children, and then you see hearing loss more in adults, especially with that aging population we mentioned, and losing hearing as you get older. So it's really varied.
With the ear, I gotta ask, and I didn't talk to you about this beforehand, but you're an ENT. Should we be using Q-tips after?
I knew you were going to ask.
How many people ask you this?
So my response to everybody is you should not put anything smaller than your elbow into your ear.
Smaller than, okay, that's good to know.
So that's I see a lot of patients with wax impactions because with not just Q-tips, but people come in with all sorts of things that they admit as I see their ear. They're like bobby pins, there's a lot of different things that people put in their ears. And I tell everybody, please don't put anything smaller than your elbow. And they kind of look at me. And then, usually the old timers give me a joke when I'm looking through their ear, like, oh, can you see right through? And I say, absolutely. So
out the other side?
Yeah.
That's funny because it's hollow. I gotta ask another question, like to release the stigma on this, because when I was in college, people used to do this, not really at parties, more like get-togethers, like people watching movies. So they would take candle wax.
Right, that's called candling.
And pour it down their ear and wait for it to harden and then try to pull it out and get, I guess...
Where'd you go to school? Because I did not have that happen in my college. We did other things. I want to know where you went to school.
I did 2 years in Orlando and 2 years at FAU, but this was up in Orlando in my early years. Okay. I didn't do it though, Dr. Gupta.
Okay.
I do use Q-tips though. After the shower.
Okay, so after today, after talking to me.
Yeah, definitely. I'm going to try it again. Last time I had an ENT on, I got 3 weeks without using them.
Seriously?
Yeah. That could have been a habit by then.
But 21 days, you're supposed to...
I know. I don't even think I was like craving it. I just did it.
Yeah. Well, I can tell because just like you have sweat glands in certain places, the cerumen glands are only in the outer third of the ear canal. And so when the wax is pushed against the eardrum, it's like a tube. I just know. And so you don't have to tell me or admit to me anything. When I look in your ear, I know you've used Q-tips, and I'll say, oh, so you've used a Q-tip. Oh, doc, I only used it on the outside. Believe me. And I'm like, okay, no problem. But
it's good to know. Now, you said you find a lot of, people come to you with a lot of things in their ears. What about the nose? Same thing?
Nasal congestion, difficulty breathing, runny nose. This is common. And, commonly you start off with your primary care doctor, but allergies are a huge, it's even growing more and more patients having chronic allergy issues. So that's probably the number one thing I see the most, was nasal conditions.
Okay. And then I have to ask you about the throat too, and I'm going to kind of localize this to myself. So I'm a huge Pearl Jam fan. I just came back from Fenway.
Too.
Are you really?
Yeah, but I didn't. Did they
just came back from Fenway Park.
Oh,
I was up in Boston for 2 shows.
Wow.
And I did Seattle 3 weeks ago. So Fenway Park was my 27th show this past Tuesday. Anyways, Eddie Vedder over in London during the summer, at the tail end of a show, his voice started going. I've never heard his voice sound, subpar.
Right.
And I'd heard about it, read about it. Long story short, when I heard the recording, it all fell in. He had to cancel the next day because for the first time in his life, the doctor on board on the tour said, "Hey, you sing tomorrow. You guys play London tomorrow. You may never sing again." So they had to cancel the show. He got his voice back like 3 days later. They ended up touring through Europe and came back and did the show a month later. Now, obviously, you don't probably see a lot of singers. You probably see a few here and there, but what are some of the voice disorders that can happen from like talking or singing or yelling? Does that really exist with the common person?
Absolutely. I see a lot of professors. I've seen who speak every day, teachers. I see local singers, and whenever I see one, I say, "Well, let me hear you sing, so I know that you're actually what you are." But yeah, no, we see people with hoarseness because of many different reasons. Acute laryngitis or acute hoarseness. But then if you have people who overuse their voice, they can get polyps, nodules. You've heard of singer's nodules.
Yeah, I think that's what he had.
Right.
Something like that. I didn't really see the whole diagnosis, but if I find it, I'll send it to you. Knowing that you're a fan, that's awesome. That really is. I saw him in Chicago 2 years ago, too, at Wrigley Field.
Wow. We saw you too at Wrigley Field.
Whoa, I've never seen you two. They're on my list. And I wanted to see them in '92 on the Europa tour, but I was a little young. My dad wouldn't take me. Sorry, Dad, to call you out if you're listening. I also want to ask you, head and neck tumors. Now, that's something that an ENT can help. And what exactly is a head and neck tumor? Is that something, obviously, that develops on the outside of the skin or inside?
Both.
Oh, really?
And so you can have like a lump or a neck mass. Sometimes people can notice something when they're shaving for men, or they feel something. It can include anything like salivary glands, the glands that supply saliva. Yeah. The most common cancer is squamous cell cancer, and that can come from anywhere in your aerodigestive tract. But there's a lot of different types of lipomas, neuroma, different types of tumors that can present in the head and neck area.
Do you see a lot of the squamous cell in South Florida because of, we're always at fun in the sun kind of lifestyle? So
that's squamous cell cancer of the skin, which is a separate type of, that's a skin cancer. So squamous cell carcinoma of the head and neck is a little bit different. But that's more from smoking, drinking, and then now there's a whole subset from HPV or human papillomavirus. So those are the two main reasons.
Okay. Thanks for clarifying that. I appreciate that. And head tumors as well, so on the interior of the head, but not the brain?
Not the brain.
Okay.
Not the brain.
But actually, I guess that would be, attached to the...
Well, you can have, skin cancer that presents as lymph nodes in the neck. That's not common. But normally, when we're talking about head and neck tumors, it can be both malignant or benign.
Fantastic. Now we're here with Dr. Hina Gupta, ENT, head and neck surgery. We just talked a little bit about that. What is the name of your practice in Coconut Creek?
ENT medical specialist, and I'm part of South Florida ENT, which is a large group of ear, nose, and throat doctors in South Florida.
Fantastic. And you have a website as well? That's where I got some of this info.
Oh, great. I'm glad you went to the website.
Yeah, it was great. They got a great layout, ton of info.
Oh, good.
And that's what you want, because people are, I'm telling you, people research nowadays. They go on, they get comfortable. Right. I know from the marketing research, people watch videos. That's why this show does pretty well. People will watch videos and get a feeling for the doctor. Right. Physician videos as well. So that's important.
The website is mybrowardmd.com.
Thank you. MyBroward, like the county, md.com.
Yep.
Perfect. And did you want to give out the phone number as well?
954-943-1133.
And I will mention that again before we go. I also wanted to ask you, since I have you here, I'm like just knocking off questions one after another, but like I said, I don't get an opportunity to interview many ENTs. Are you on staff at a local hospital?
Yeah, I'm on staff at Broward Health North,
Nice.
on Sample 95, and then at Coral Springs Medical Center.
Okay.
And I was on staff at Northwest. I was actually at West Boca too, but right now at those two.
Yeah,
That's where
Coral
I
Springs
was.
Medical Center. I know the CEO, Jared Smith. When I met him at Del Rey Medical Center when he was there. So I'm glad to see him over there. That's great news. And I used to have an office right next to Broward Health Imperial Point.
Oh, okay.
I know you're not at that one. You're at the one a little bit north of that.
Right.
But that's a great hospital as well where you're at. So we're here with Dr. Hina Gupta. I wanted to ask you also, I luckily didn't have strep throat too many times, but if someone does, I mean, normally at that age, that's what about like 11, 12, when it really can become a problem and people would have to have their tonsils out. Is that something that you help with as well?
Absolutely. So, yeah, if you have numerous infections, then you're going to at some point need your tonsils out. But the criteria has gone up and up, like probably when, 30 years ago, they were taking tonsils out more frequently than they are now. But
Okay.
if you, back before then, it was more common than it is now. But if you're getting recurrent infections, then absolutely. And
Now-
it's not just in that age group too. It can present at a younger age, or sometimes I even see people in young adulthood who didn't have it done prior and they're still having recurrent infections.
Okay, yeah. I never wanted strep throat, but the few times I had it, I kind of wish I was able to go to the hospital so I could have ice cream.
Right.
Is that something that they still do?
Popsicles, all
Popsicles.
the popsicles that you want.
Oh, yeah. No, actually, I'm glad that I never had it, though. But now, would, say a parent's listening or viewing, and their child has a sinus issue, or maybe even something that looks maybe like strep throat, like a nasty throat virus. I don't know if it's a virus. Is it a virus? Strep throat?
Bacteria.
Bacteria, okay. I know there's a difference.
But it's very common to have viral pharyngitis.
Now,
Like,
would-
viral sore throats are very common. But they're, self-limited.
Would they just call your office at 954-943-1133 and schedule an appointment with you, or would they have to be referred by a primary care physician?
Well, it depends on your insurance nowadays.
But they
right?
can call and ask that question.
Absolutely.
Your staff could help them
Absolutely.
out. Okay, that's good to know. And it's mybrowardmd.com. That's a great website URL. Hold on to that one for sure. We're here with Dr. Hina Gupta. She is an ENT, ear, nose, and throat doctor, and head and neck surgeon. Why did you decide to become an ENT? The million-dollar question.
I liked doing surgery, but I really liked following through with one disease state and offering all the options. Nowadays, it's like sometimes patients feel like a pinball where they are referred from one doctor to the other, and ear, nose, and throat allows you to do everything in terms of medical management, surgical management if needed. And that, ultimately it's very satisfying when you take care of somebody and somebody feels better at the end. When you actually help somebody, it's, you can sleep well at night, so.
Speaking of sleeping, do you do sleep medicine as well?
I do some sleep medicine. Like,
Okay.
for example, we were talking about tonsils. Taking tonsils out is more, it's becoming more common in sleep apnea patients, even in children.
Well, I'm going to check my insurance and call your office because I think I need an ENT because I have a couple of those ailments. We have less than a minute left, and I just wanted to ask you one last question. I always ask doctors, what are your hobbies and passions in life outside of medicine?
I love traveling.
Oh, me too.
You do?
Yeah.
I love traveling. I'd like to kind of see the world. As soon as my kids are, not fighting all the time and are, not little tiny toddlers anymore, I'd like to take them to all the national parks. I love traveling.
Yeah, it's great. Well, thank you for coming on the program. We'd love to have you on again. I really appreciate all the info. It's Dr. Hina Gupta. She's an ear, nose, and throat doctor. MyBrowardMD.com, 954-943-1133. Check her out, and we'll see you next time. Stay Healthy show.
For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.